Dr. Patel, could you please explain what are orthotics basically? What is that?
The orthotics are medical devices that are prescribed by your podiatrist to help align and improve conditions that are related to your feet. They are designed by using a laser scan, which is done in the office and then fabricated custom in a lab along with the specific prescription that the doctor sends. Now, the specific prescription may involve changing the density of the orthotic, changing the support structure of the orthotic, and modifying it in multiple ways in order to provide the added or intended support that it was designed for.
Dr. Patel, for diagnosis, can orthotics be beneficial?
Orthotics can be used for a variety of diagnoses. For something like plantar fasciitis, something like posterior tibial tendinitis, Achilles tendinitis, all these issues related to the rear part of the foot. They can also be beneficial for conditions related to the front of the foot, which can include Morton's neuroma, hallux limitus, amongst a lot of other specific indications. In addition to that, orthotics can be used as a preventative device in order to provide support for some individuals that have maybe a flatter or a higher arch and perform specific activities, for example, sports or activities that involve a long time on your feet.
Dr. Patel, what is the difference between orthotics, insoles, inserts?
So we have to differentiate between the specific type of device that we are talking about. Custom orthotics are designed by a podiatrist or a medical practitioner. They are scanned custom to the patient's foot using a laser device or traditionally using a plaster cast. They accommodate for every specific lump, bump, and contour of the patient's foot and are really custom devices that are individual to every individual patient. They can also be adjusted in a multitude of ways, and this allows them to be controlling or have control over the patient's specific condition. Over-the-counter devices are designed for the general public based off a standardized cast and are indicated for a limited amount of indications. For example, plantar fasciitis or posterior tibial tendinitis being the two primary uses we recommend them for. They are not specific to the patient's foot, so they may be slightly larger or slightly smaller. They may have an arch that is not in the correct position when compared to certain patients' feet. So they are okay for some patients, but for specific indications and specific custom indications, they are generally not advised when compared to a custom orthotic. They are also inserts that are available or come with certain types of shoes. These are removable and are essentially a spacer to fit between your foot and the shoe. They generally don't provide the level of control or biomechanical correction that a orthotic or a over-the-counter insert will provide.
Dr. Patel, speaking of shoes, are the orthotics customized or can be customized for any kind of footwear?
Absolutely. Orthotics, because of their custom nature, can be designed in multiple ways. They can be made to be high profile, high strength bearing, low profile, and so we can use them in anything from dress shoes to sneakers, athletic wear, to casual shoes. They can also be specific to certain sports. So we can design orthotics that fit into ski boots, that can fit into ice hockey skates, and the options are endless based on the indication.
All right. So, Dr. Patel, why a patient needs customized orthotic? Is the prescription from a pharmacy, from something ordinary, cannot work?
So the reason why we recommend custom orthotics compared to an over-the-counter or something from the pharmacy is for two reasons. Number one, a custom orthotic is truly custom. It will accommodate for every bump, lump, and contour of our patient's feet. Custom orthotics can be adjusted and manipulated in infinite ways. So we can account for neuromas at the front of the foot. We can account for limitations in joint range of motion at the front of the foot. We can account for high or low arches. We can control the internal or external rotation of the heel bone. And all of these are related to certain pathologies. So we cannot do that with a device that is made in a factory for a non-custom or non-specific indication, which is why custom orthotics have a lot more flexibility as well as uses that are more beneficial to our patients.